Good afternoon. My name is Ebony Caldwell, and I am the System Director for Diversity, Equity, and Inclusion with Rochester Regional Health. And I'm here with Dr. Bipul Baibhav, a cardiologist for Rochester Regional Health. February is Heart Month and Black History Month with the theme of Black health and wellness. We are here today to discuss how genetics, cultural identity, and social determinants of health impact the risks for heart disease. We want to invite everyone watching to chat or leave your questions in the comment sections. And so we're going to go ahead and get started. And let's start with our first question about cardiovascular disease. Just how prevalent is it in the United States?
Thank you, Ebony, and thank you for having me on Facebook Live. Uh, Heart disease is the leading cause of death, accounting for around 25% of deaths in all adults in the United States. And approximately 700,000 people die from heart disease in the United States every year. If we were to extrapolate that data, approximately one person dies from heart disease every 36 seconds. And the most common form of heart disease is what we call coronary artery disease, which is blockages in the heart arteries leading to heart attacks. And one person gets a heart attack every 40 seconds in the US. So it's although we've made good amount of progress in identifying and treating and modifying risk factors for heart disease, but it still remains the number one cause of people dying from heart disease in the US.
Thank you. And that leads us right into our next question. What are the risk factors that impact heart disease?
So risk factors for heart disease are categorized in two variables. So there are some non-modifiable risk factors. And by that, what I mean is things that we cannot modify, such as age. We cannot change. I wish we could, but we couldn't. We can't. And then there may be some susceptibility to heart disease in certain populations, like patients who are Black have a higher incidence of high blood pressure. We don't understand the genetics of that very well, but that is the case. Patients who are from the South Asian region have higher prevalence of coronary disease. So these are things that we cannot modify, but there are modifiable risk factors such as smoking, cessation of smoking, good diabetes control, healthy diet, regular exercise, controlling our cholesterol, which are modifiable risk factors, and controlling blood pressure, which is also very important. And if we modify these risk factors and control these risk factors well, then our risk of heart disease decreases significantly.
Great. And so you talked about the genetic risk factors, which are things that we can't modify. What's the difference between genetic risk factors and social determinants of health?
So genetic risk factors are things that is our biology or what race we might be born into or our makeup of our genes, even in even if there may be variability in that. But what we've noted is rather than, and this is research in the past has focused on a lot on the biology or genetics of heart disease, but a lot of recent research suggests that social determinants of health have a bigger impact on our quality of life and outcomes compared to some of these genetic or biological variables. And the World Health Organization defines social determinants of health as conditions in our environment, the environment that we are born in, we grow up in, we play in, we worship in, we go to work in, or we age in. So there are a lot of different conditions in our environment that really impact our health and outcomes, and those are considered, social determinants of health.
Thank you. I think we talk a lot about social determinants of health now, and so that definition is very helpful. Another question is, when considering disparities in heart disease, who is most at risk and why?
So, in the view of the recent coronavirus pandemic, we've noted that disproportionately communities of color in underserved neighborhoods have been impacted much more than people who are in more affluent neighborhoods or where there are more resources. So that has shed more light on this challenging problem that we are dealing with. And when it comes to heart disease, for example, hypertension, which is quite prevalent, and in 43% of adults in the US have high blood pressure. And what we've noted is that the prevalence of high blood pressure is higher in the African American population, but adequate treatment is not there compared to when we look at other ethnicities. So complications from high blood pressure, such as heart attack or stroke or even kidney disease, is higher in the African American population. We also note that sometimes timely interventions, like procedures or referral to heart transplant for people who have advanced heart failure, although it's more prevalent in the African American population, those referrals still lag compared to the white population or other ethnicities.
Thank you so much. And for those of you just joining, my name is Ebony Caldwell, and I am the System Director for Diversity, Equity, and Inclusion at Rochester Regional Health. And I'm here with Dr. Bipul Baibhav, a cardiologist with Rochester Regional. And again, we want to invite you to please chat or leave your questions in the comments section. And we have a few more questions. What are social determinants of health, and what are the major issues that impact health?
So, social determinants of health, as I said, are conditions or environments that we grow up in, we age in, we work in. There are multiple factors. So, one of the most important factors is socioeconomic status. So, what we've noted is patients who have a poor socioeconomic status have poor health outcomes, and that may be related to job security, safe housing. So a lot of those things can impact it. Other important thing is educational status, because if people are educated, their health outcomes are better, they understand their conditions better, they take preventive measures to avoid bad outcomes. Blood pressure control is better, diabetes control is better. Safety of neighborhoods is extremely important. Access to grocery stores where healthy foods can be purchased is extremely important. Safe places to exercise is extremely important. Then access to healthcare. So a lot of our patients who are in underserved communities may lack health insurance, or even with health insurance, the premiums may be too high, so they delay getting preventive care. So although with the Affordable Health Care Act, a lot of uninsured people have access to insurance, but still some of the cost may be prohibitive. Another example, especially with COVID pandemic, was increased use of telemedicine. But we know that broadband access is an issue for many of these neighborhoods. So trying to do telemedicine when you don't have good internet connections can be a challenge as well. Or health literacy regarding use of these devices. And obviously, racism and implicit bias and discrimination also is very important. And as physicians too, sometimes we have to recognize our implicit biases. These kind of factors, so there may be socioeconomic, educational, access to healthcare, social context in terms of people, if they have, caring family members and neighborhoods, and if they are integrated into their communities, their health outcomes are better.
A lot to consider, internal and external factors, when considering patient outcomes and how we move this work forward. Can you share a little bit more of what is the data that demonstrates how these determinants impact heart health?
So, for example, African Americans have a higher incidence of high blood pressure and high risk of complications from high blood pressure, such as heart attack and stroke. And they also have increased risk of heart failure. But what we note is that the control of blood pressure in African Americans is very suboptimally controlled. So overall control is not very good in general population, but when we look at subgroups such as the African American population, the control is poor, and that leads to worse outcomes. I run the hypertrophic cardiomyopathy program, which is a form of heart failure. And what we've noted is data suggests that referral for advanced therapies, which may be surgical procedures, or heart transplantations for this condition, is lower in African American populations compared to other populations. There is also data suggesting that if we address some of these disparities with regards to education, with regards to access to healthcare, then some of these disparities, the differences come down and sometimes can even get eliminated. So when researchers have looked at neighborhoods or zip codes where it's a multicultural, multi-ethnic environment where people have good educational status and have job security, there is no difference between outcomes in different races. So we have data not only looking at disparities, but we also have data looking at where these economic or social determinant of health disparities are not there. The outcomes in different ethnicities is the same, or almost the same.
Great. And so you just spoke to the next question a little bit about how can we address these disparities. Can you talk a little bit about the resources that Rochester Regional Health offers to help educate people about risk factors of heart disease, and how can we access those resources?
Yeah, so in cardiology specific, I'm going to talk, and then I'm going to talk some generalities as well. We do have social workers in the offices. Many offices have social workers. If patients have issues with transportation, we help them with that. We also have language interpreters, we have some interpreters will come for the appointments, but we also have virtual interpreters, which we can call on the phone or on an iPad-like device. So if patients have language barriers, we can address that. In our offices, we do address self-monitoring of blood pressures. So we teach patients how to check their blood pressures. We also are with more adoption of technology so that the patients can directly message their provider through our electronic medical system. We encourage patients to send in their blood pressure values. So although we may be seeing them every 3 months or 6 months, we do encourage them to send their blood pressure values so that we can adjust medications sooner rather than later. So these are some of the RGH or cardiology specific things that we are doing.
Thank you. Thank you. And I know across the system, we also have a DEI series that addresses implicit bias, so that people are taking a look at themselves and realizing how we are interfacing with one another as colleagues, as well as how we interface with our patients. So we're doing a lot of work across the system to really get at some of those disparities. And our final question today, what are some immediate steps that we can take to reduce heart disease risk?
So that's a great question. American Heart Association a few years ago came up with 7 steps to reduce our risk of heart disease and stroke in all Americans. And again, these stress the importance of managing our modifiable risk factors. So managing blood pressure is extremely important. And so making sure if we have a blood pressure, first of all, to check your blood pressure, because sometimes the high blood pressure can go undetected for a long period of time. So it's important to pay attention to blood pressure. Sometimes we may think that we are only 30 or 40 age and we may not have blood pressure, but sometimes we get surprised. So first important thing is to be aware of the problems that can arise and proactively address those issues. So managing blood pressure is extremely important. Controlling cholesterol is also important. So there are some bad cholesterol, some good cholesterols. So addressing good cholesterol with diet, and sometimes we may need medications, is extremely important. If we have diabetes, then managing blood sugar and controlling diabetes adequately is extremely important. Getting active. Some exercise is better than no exercise. So even if we can do 20, 30 minutes of exercise a few times a week, that is great. And what we've noted is the beneficial effects of incremental exercise. So the more we do, the better we are going to get. And the outcomes are better. And tied into all, managing weight and blood pressure is obviously eating better too. So avoiding diets which are saturated fats or processed carbohydrates, more greens and lean proteins really helps reduce our risk. So like some lifestyle changes, and then if we have high blood pressure or diabetes, really managing those well.
Thank you. Is there anything else that we are missing that's important for our viewers to know today?
I think it's very important that when you visit with your primary care physician or your cardiologist, to bring to their attention some of the challenges that you may be having. We are doing more and more provider education to ask the patients, are you having trouble with financial issues, for your medications? Are the medications expensive? Second thing is, are you having issues with transportation or coming to the appointments? Are you having issues with language barrier? Or are you having issues with understanding all the directions? So I think it's very important. We as providers are also asking more of these questions, and we are trying to educate the next generation of cardiologists or fellows to address those questions as well. But I think more dialogue is extremely important so that we can get better and have better outcomes.
Right. Asking the right questions at the right time can get us to the right care. That's awesome. Okay, so thank you so much for joining us today. Thank you, Dr. Baibhav, for taking the time out of your schedule to talk about heart health. And again, if you're watching, feel free to leave your questions in the comment section, and we'll be sure to answer them even after the live video. Thank you so much.
Thank you.